I welcome the idea of the CCIOs. I think it's a great endeavour. I think the networking will create some new alliances which will be very important in taking forward the clinical aspects of healthcare and making sure that the new IT is actually very clinician and patient orientated. One of the things that CCIOs are going to be involved in, I think, is about clinical interoperability and making sure the clinical meaning that's generated in one place is adequately transmitted to the next place in the patient care. And the bit to me that was missing today was standards. Because unless you standardize exactly what you mean, then you're going to lose out. And we're going to have this sort of lost in translation phenomenon between one IT system and another. So, as somebody who's from pathology, I've been working with the college and with Connecting for Health the past 3 years to actually say one name for an analyte, one SNOMED code, one unit of measurement, one UCOM unit to send it around the place. So we're working on rigid standardization of pathology data, and that way we create some objects that get used not just to send a message from the lab to the GP, but also that can be used in the clinic letters, the discharge summaries, in research data, cancer networks and all the rest of it. So I think we're starting to create something that enables the interoperability, but it's the boring bit behind interoperability. And if we don't get the boring bit right, we won't get the zany bits right. A, I think we've got the pathology world on board. B, we're starting to get the laboratory people on board. We've got the GPs on board with the major users. We've got the research community on board, recognizing the importance of this stuff. What I think we're now starting to say is actually what we're doing for pathology is a model for other things. Because if you want to actually have a data set for drugs, you either have a huge, great long list, or you actually have paracetamol, 800 milligrams, 400 milligrams, capsules, caplets, tablets, enteric coded, non-enteric coded, etc. And that's what the pathology work has been done. It's called the National Pathology Catalogue, but actually it's e-pathology.
I'm absolutely thrilled with this. This is something that we've been waiting for to happen for ages. I've been National Clinical Lead for Midwifery for Connecting for Health, Department of Health Informatics Directorate for 4 years now. And my tenure is just coming to an end at the end of March. And we've wanted to have a broader network of clinical leaders and clinical influencers, not just for what's considered informatics and IT and tech, but how information is used for care, what difference it makes for patients and what difference it makes for nurses, midwives, doctors, allied healthcare professionals doing their care every day. It's absolutely across the board, and it's vital that we get a network like this going. It's valuable because you've got someone that sits across the whole thing, and I think we've heard earlier a little bit about whether they should have a lot of technical knowledge or a little bit, or just be able to walk in that world. And I think it's the middle line. It's walking in that world and knowing when you've got to ask a question. I've been National Clinical Lead for the NHS number for the past 3 years and turned up into the demographics programme where everything or every other word was an acronym. I didn't understand what they were talking about and had to keep stopping them every step of the way as I chaired the board. Ultimately, I could sort of understand the acronyms, and I'd say to any new member of my board, please stop us if you don't understand anything. And I think that's the gift a clinician has, is that if you hear a term or a condition you don't understand, you immediately say, hang on, I've never heard of that drug before, tell me what that's for. The network really needs to grow and develop, and we need to encourage new members. Now, I think that obviously we talked about growing nurses and midwives as actual CCIOs, and I've given an indication that these people probably already sit there in the world of governance and clinical safety. We need to draw them out and give them confidence to work in the area of information so that they can actually contribute. We need to hear their voices, and sometimes something with a technical headline won't entice them in. So you're going to need some good champions out there building this network and making it work.
Well, I think today's been a first-class day. I think it was fantastic to have the Secretary of State for Health here today endorsing the Leaders Network. We know from our experience at Cerner that when you have clinicians driving implementation, procurement and development of solutions in information and data, projects work an awful lot better. CCIOs are a vitally important part of the health service, and today is the first step in improving and making CCIOs at the heart of NHS information and data. data. I think there's going to be a number of events over the course of the year involving CCIOs. I think that can only help in terms of appointing more CCIOs at NHS trusts, both in the acute sector, in the community sector, and in the primary care sector. We need to have champions of clinical information across the NHS and across healthcare. This is the first step. I'm looking forward to the next events, and I think the campaign and the network will go from success to success. Well, the reforms going through the NHS at the moment will require high quality information and data, and access to that high quality information and data. Having clinical champions driving that information and data, it will only improve the quality of care, the efficiency of care, the safety of care, and it will improve the NHS.